Chapter 28, Dermatology. The skin or integument is the largest organ of the body. Clear skin glowing with health indicates a good general state of wellness. Pallor, cyanosis, or dry, scaly skin indicates poor general health. Unbroken skin provides a protective barrier that prevents the entrance of microorganisms and is the body's first line of defense against infection. In addition, the skin protects the body from mechanical injury, damaging substances, and ultraviolet rays of sun. Although it has many functions, including maintaining homeostasis, one of the most important functions of the integumentary system is to protect the underlying tissues and organs from the external environment. Picture of our layers of skin. So some common disorders of the integumentary system. The first one they talk about is skin infection. Lesions or abnormalities in skin tissue show underlying disorders. Patient can be very infectious, so you should make sure that you are wearing your protective attire when treating and examining your patients. So some of your primary lesions they talk about. The first one is a macule. A macule is a small, flat discoloration of the skin. The papule. The papule is an elevated or solid lesion smaller than 2 centimeters, and then the colors will vary. A nodule. Nodules are raised solid lesions that are larger than 1 centimeter. And then you have your vesicle, which is your skin lesion that appears as a small sac containing fluid, or in other words, it's just a blister. A bulla. It is a vesicle or a large blister that's larger than 1 centimeter. Your pustule. Your pustules are lesions that contain pus. A wheal. It's a transient elevation of the skin caused by edema of the dermis and surrounding capillary dilation. Plaque is an elevated solid lesion on the skin or mucosa, which is larger than 1 centimeter. A cyst is a tumor that contains a semi-solid or liquid material. Your secondary lesions are scales, heaped up horny layer of dead epidermis. And then you have crust, which is the covering formed from serum, blood, or pus drying on the skin. Fissure. A fissure is a crack in the skin. An ulcer is a lesion formed by local destruction of the epidermis and part of the underlying dermis. Other lesions would be superficial folliculitis, which is a local infection of a hair follicle. Furuncle. It is an acute inflammation that is deep within the hair follicle. And then a carbuncle, which is an infection involving subcutaneous tissues around several hair follicles. All of those can be found on page 699 in your books. So now we'll talk about bacterial infections. The first one they talk about is impetigo, which is a highly infectious skin infection causing erythema, which is swelling, and progressing to a honey-colored crust. Erythema is redness of the skin. Impetigo, vesicles, which produce honey-colored drainage. A crust follows the redness, and then the vesicles, they leave a red areas when crusts are removed. So impetigo may be caused by Staphylococcus or Streptococcus microorganisms. So treat these with good hygiene, a topical or oral antibiotics for severe cases. You want to discourage your patients from scratching. Scratching could lead to infection. So those that are at risk are those that are in poor health, those with conditions such as anemia or malnutrition, and then those with poor hygiene. Treatment is washing the area 2 to 3 times a day and applying a topical antibiotic as ordered by the physician. Folliculitis. Folliculitis, it is inflammation of the hair follicles. There is itching, burning, the formation of a pustule. The treatment is aimed at promoting drainage and then healing. So you want to treat it with some saline soaks or some compresses. The causative agent is Staphylococcus. If folliculitis is left untreated, it may lead to the formation of an abscess. And then an abscess is formed when a small sac of pus or purulent material accumulates at the site of the inflammation. And then those compresses should be ordered for 15 minutes twice a day. A furuncle. A furuncle is an infection in a hair follicle or gland that's characterized by pain, redness, and swelling with necrosis of tissue in the center. Your furuncle is also known as a boil. It is a deep-seated infection. It becomes a nodule. Sometimes an incision and drainage or an IND may be needed. So the causative agent is Staphylococcus. So the treatment of a furuncle, it includes the application of moist heat to assist in ripening it or bringing it to a head, and some antibiotic therapy. So some friction and pressure at the site may contribute to the formation. Often, so we know that the IND may be performed often to remove the purulent material and facilitate in the healing of the furuncle. A carbuncle. A carbuncle is an infection of interconnected group of hair follicles or several furuncles that form a mass. So an infection is interconnected group of hair follicles or several furuncles that are joined together in a mass. The patient could have a fever with this because it's of the infection. So to treat it with moist heat, a systemic antibiotic. Sometimes it may cause for an IND, which is the incision and drainage. And then you want to make sure that carbuncles, they're going to be hard, round, extremely painful, swelling that enlarge over several days to a week. And then the causative agent is Staphylococcus. Cellulitis. Cellulitis, it's an infection of skin surrounding a wound. It's hot, it's red, it could be edematous. It can develop into an abscess. Do you want to treat this with a systemic antibiotic also? Inflammation or infection of the skin and the deeper tissues that may result in tissue destruction if not treated properly. That is cellulitis. So now we'll move on to your viral infections. The first one they talk about is herpes simplex, which is an infection caused by the herpes simplex virus or HSV. Herpes simplex, it causes lesions. It could be cold sores or better known as fever blisters. The lesions are highly infectious. They are painful. It's an ulcer, and then it forms a crust. So your antiviral drugs, such as your valcyclovir or your aciclovir, have been shown to decrease the severity of herpes simplex outbreaks in some people, but they do not offer a cure. So there is no cure, but you can manage the symptoms. Herpes zoster. It is infection caused by reactivation of the varicella zoster virus, which causes chickenpox. So your herpes zoster, they could be in the form of shingles. It comes from the same virus that causes chickenpox. It causes lesions, which could be cold sores or fevers. The lesions which appear on the lips, the mouth, or face, they can be on the nose. They eventually erupt, leaving a painful ulcer, and then they crust over. These lesions also are highly infectious. And then these lesions occur along a nerve pathway. So these infections, they could be precipitated by other infections, such as the upper respiratory infection, or by menstruation, fatigue, trauma, stress, or exposure to the sun. This is a picture of herpes zoster or shingles. Shingles, yes, they do follow a nerve path. So that is one way that you can tell if they're shingles or not. Verruca, it's just a simple wart. Verruca is a squamous cell papilloma or benign skin tumor. Let's remember that benign means non-cancerous. It is most commonly on your hands and feet, and it can be found anywhere on the skin or the mucous membranes. So the causative agents include papilloma viruses, and the treatment is just the removal of the wart. So it can be achieved by keratolytic agents, which cause softening and shedding of the skin. Sometimes they may use liquid nitrogen, which freezes and destroys the affected tissue. Podophyllum resin, which is a causative agent that is found in many over-the-counter wart medications. They may use laser therapy, which also removes the affected tissue using radiation. So those are some, and they can also be surgically excised. And then sometimes they just disappear spontaneously. Fungal infections. Your fungal infections could include dermatophytosis, which is caused by dermatophytes, which is mold. Dermatophytosis is a simple fungal infection of the skin, and this is treated topically or orally with medication. Glycofulvin is the medication that they prescribe for fungal infections. Some fungal infections could be known as ringworm also. That is a member of the fungal infection group. So we have Tinea capitis, which is common in children. It's characterized by a round gray scaly patches or the dried skin flakes, and areas of alopecia, which alopecia is baldness. So the group of fungal diseases called tinea, it is collectively known as ringworm. Its members are named according to the area of the body that it is infected. So tinea capitis affects the scalp. So tinea corporis is characterized by itchy red rings that are clear in the center with a scaly border. They are normally found on the face and the arms, but may also be found on the trunk. So tinea corporis, also known as tinea cercinata, they manifest on hairless portions of the body. So your tinea corporis, which is your ringworm, is a fungal infection. Tinea cruris, these are your red macules, which with clear centers and scaly borders. The causes are marked with itching. They are known in lay terms as jock itch. It is found on the skin in the groin area and the gluteal folds. We have tinea pedis, which is better known as athlete's foot. It is characterized by itching, burning, and stinging between the toes and on the soles of the feet. These vesicles are red and weepy, chronic dry scales, and sometimes you have the fissures or crack-like lesions in between the toes. Tinea unguum. This is also known as onychomacosis, which causes thickening or discoloration and crumbling of the nails, most often on the toenails. This is difficult to cure, often requiring months of local antifungal preparations. In severe cases, oral antifungal medications are prescribed. Tinea versicolor, also known as pityriasis versicolor, is a fungal infection. However, it is not caused by dermatophytes. It is known exactly for what sort of fungus is the causative agent. So it could be multicolored, asymptomatic chronic rash on the upper trunk. Is most common in young people during warm weather, and the lesions, they vary from macular to raised, round, or oval. They vary from darkly pigmented to depigmented and are slightly scaly. The diagnosis of tinea versicolor is determined with a Wood's light, which is an ultraviolet light used in a darkened room to show abnormalities in the skin as fluorescent. So, your parasitic infections. Scabies. Scabies is a contagious skin disorder that is caused by the itch mite Sarcoptes scabiei. The treatment for scabies is aimed at just basically disinfection. It is spread by direct contact and produces small vesicles or pustules between the fingers and the wrists, elbows, axillae, waist, and groin. The mites, what they do is they burrow into the epidermis, which causes the itching. So this is treated by laundering the bedding, etc. So the itching that's caused by the mites is worst at night. And this is when the females burrow under the epidermis, and that's when they lay their eggs. Pediculosis. Pediculosis, it is lice, an infestation with parasitic lice. Lice of the scalp, the body, the eyelashes, and pubic hairs. Intense itching that's due to lice feeding on blood. You can see the nits at the base of the hair follicles. So you treat this with benzene hexachloride topically. You want to make sure that all bedding and clothes, dry cleaned, hot laundering, plus ironing, seal items in a bag for 30 days or heat the items to 140 degrees Fahrenheit. So they feed on the human blood and lay eggs or nits on the body hair or clothing fibers. The infestation is transmitted through physical contact with an infested person by sitting on an infested toilet seat or by sharing a comb, a brush, clothing, or bedding that has been infested. So some inflammatory reactions. The first one we have is eczema. It is a superficial dermatitis. Eczema, it is a chronic condition of the epidermis with an often unknown cause. Your causes could vary. Could be from food or pollen allergies, different types of medication, household allergies, poor circulation, or UV light. You have itchy red lesions that are progressed to scaly patches. The treatment is to remove the cause if you can determine the cause. You want to keep the skin moist, maintain good hydration, and then a humid environment is recommended. So exudative lesions are treated with soaks, baths, or wet dressings for 10 to 30 minutes for 3 or 4 times daily. They also use topical corticosteroid lotions, creams or ointments twice a day, bandages at night to protect against scratching, antihistamines for severe pruritus, which pruritus is itching, and then for scales, a topical steroid ointment, and then systemic corticosteroids in your very severe cases. Seborrheic dermatitis. It is skin inflammation, which is the overproduction of sebum by the sebaceous glands. It is a chronic disorder of greasy yellow scales, primarily on the scalp. An underlying redness and pruritus may be present. It could be eyelids, face, chest, back. The umbilicus and body folds may also be affected. So for treatment, they have a special type of shampoo and then your topical corticosteroid lotions. It is thought that seborrhea is caused by a genetic predisposition and a combination of hormones, nutrition, infection, and could be also brought about with stress. Urticaria is hives. It is acute reaction which causes wheals. It can precede dyspnea and anaphylaxis. So with this, you would give epinephrine or EpiPen, treated, antihistamines, prednisone, which is your steroid. So the treatment of urticaria is the reduction of the inflammatory response. Some of their common causes could be that the person comes in contact with a certain food, inhale allergens, chemicals, cosmetics, medications, sunlight, insect venom, heat, cold, or pressure on the skin, infection, and stress. Acne vulgaris. It is an inflammatory disease of the sebaceous glands. This is common in adolescence, otherwise known as pimples, comedones, which are blackheads, cysts. You treat it with tritinium, your benzoyl peroxide, and then some tetracycline. Psoriasis. Psoriasis is a chronic skin disorder that appears as red patches covered by thick, dry, silvery scales. Psoriasis is chronic. The cause is unknown. It's difficult to treat. So treatment for psoriasis could include UV lights, tar, topical steroids, your exacerbations. This is when it becomes really inflamed. Could be from cold weather, pregnancy, and stress. There are usually no vesicles, and itching varies from mild to severe. So, disorders of wound healing. Keloids. Keloids is an overproduction of scar tissue, which occurs as a complication of a wound healing. Your keloids are raised nodules that does not resolve with time. These can be treated with cortisone injections. The cause is unknown. It occurs most frequently in young women, especially during pregnancy, and is particularly common in the African American community. And then the most common sites are your neck and shoulders. So disorders caused by pressure, calluses, and corns. A callus is sometimes called a callosity. It is a raised, painless thickening of the epidermis. It's caused by pressure or friction on the hands and feet. A corn is a hard, raised thickening of the stratum corneum on the toes. It results from chronic friction and pressure, especially from poor fitting shoes. You treat with bandages, or they have corn pads and a chemical peel. So the treatment for calluses and corns begins with relieving the pressure. Decubitus ulcers. Decubitus ulcers are also known or called pressure sores and are caused by prolonged pressure to an area of the body, usually over a bony prominence. The pressure impairs blood supply, oxygen, and nutrition to that area, which results in an ulcerative lesion and eventual tissue death. So your bedridden patients or your patients who are immobile, this is common in those patients. So you want to prevent pressure sores or decubitus ulcers by moving your patients frequently or using special mattresses. You treat with the topical or systemic antibiotics, and then it possibly, if they're bad enough, they may have to be some surgical debridement. So some of your areas that are susceptible to your pressure ulcers, and when they were talking about your bony prominences, were your occipital bones, ears, scapula, elbows, sacrum, your ischial tuberous sites, your greater trochanter, the medial condyle of tibia, the fibular head, medial malleolus, lateral malleolus, and then the heels. They have a different stages of your decubitus ulcers. They stage them from 1 through 4. And you can read those in entirety on page 706 in your books. So we have intertrigo, which is a rash of the body folds. These are more disorders of the integumentary system. These are common in humid climates, people with poor hygiene. They're itchy, stinging skin fissures, and you treat with proper hygiene, some talcum powder, and then some topical antibiotics. So treatment for intertrigo is proper hygiene and an attempt to keep the area clean and dry. So a combination of heat, moisture, and friction of the skin against itself in these areas, it causes the skin to break down. Alopecia. Alopecia is caused by trauma, disease, or infection, chemotherapy or radiation, and hormonal imbalance, scarring, or genetics. It could be genetic. It's a male pattern of baldness. Permanent baldness can be treated with minoxidil, and then others is just to treat by removing the cause if possible. Find the underlying disorder. So some of the disorders of pigmentation. The first one they talk about is albinism. Albinism is genetically determined condition of partial or total absence of the pigment melanin in the skin, the hair, and the eyes. So for albinism, the skin is pale, the hair is normally white, the irises in the eyes are pink, and there is no treatment. So because there is no pigment, it's pregnant to protect the underlying eye structures from ultraviolet rays of the sun. Eye problems may develop as a result of this disorder. Vitiligo. It is a depigmentation of patches of the skin. Vitiligo is thought to be an autoimmune disorder in patients with an inherited predisposition. It's chronic, it's progressive. Destruction of the melanocytes. Depigmented areas occur as white patches that sometimes have a hyperpigmented border. So there's no effective treatment for vitiligo. Your patients are advised to protect the areas from the sun because they are prone to sunburn in the absence of melanin.